In this lecture, we are going to discuss drugs that are used in the treatment of the influenza. So let's get started. So we have categorized the influenza drugs into three based on their targets. First, those drugs that target the neuraminidase enzyme of the influenza virus. In that category, you will see three drugs. Oseltamivir, its brand name is Tamiflu. Second is the Zanamivir, its brand name is Relenza. And third is the Paramivir, and its brand name is Rapivab. So these drugs targets the neuraminidase enzyme of the influenza virus. Second is the Baloxavir marboxil, and its brand name is Zufluza. This drug targets the ribonuclease of the influenza virus. And third category is the Amantadine, its brand name is Simitril, and Rimantadine, and its brand name is Flumardine. These drugs target the M2 protein of the influenza virus. Oseltamivir, Baloxavir, marboxil, Amantadine, and Rimantadine taken through the oral route. Zanamivir is taken through the nasal route, and Paramivir is taken through the intravenous routes. An important thing, all two category of these drugs affects the influenza virus A and the B. But last, Amantadine and Rimantadine acts only on the influenza virus A. Next, we will see the structure so we can understand easily the mechanism of the influenza virus drugs. First, you will see two most important proteins, heme agglutinin that helps in the attachment of the virus with the cell. Second is the neuraminidase enzyme. This enzyme present on the membrane. This helps in the detachment of the virus from the cell after the replication. Next, you will see two most important protein, M1 protein and the M2 protein. M1 protein is a matrix protein and M2 protein is a channel protein through which the H positive ions can move easily. Next, you will see 8 segments of the RNA. RNA will be negative strand, and along with that you will see the presence of the RNA polymerase, which has 3 subunits, which we will discuss later. So this is the overview of the influenza virus structure. Now, first is the neuraminidase enzyme. Cell having receptor, and at the receptor you will see the presence of the sialic acid. Sialic acid. This is the site where heme agglutinin binds. This is the heme agglutinin. Now, virus enter into the cell, and after the replication, virus has to exit the cell. Now, during the exit process, you will see virus heme agglutinin attached to the receptor having sialic acid. Now, for the detachment, neuraminidase enzyme that are also present on the membrane, neuraminidase enzyme cleave this relationship, cleave the attachment of the heme agglutinin with the sialic acid, and ultimately when this happens, this virus will get separated. But on the other hand, if we take the neuraminidase inhibited drugs like Oseltamivir, Zanamivir, and the Paramivir, these three drugs block the neuraminidase, on the membrane, and after the blockage, the attachment or the detachment of the virus with the cell will not happen, and ultimately virus cannot release from the cell. So this is the mechanism of neuraminidase inhibitors. Second is the ribonuclease, that is the target site of the Baloxavir. RNA has 3 subunits, PA, PB1, PB2. PA acts as ribonuclease. Okay, we will see. Here is the host messenger RNA, here is the viral messenger RNA. Host messenger RNA having cap and the tail, and viral messenger RNA having RNA polymerase. RNA polymerase subunit, that is PA subunit of the RNA polymerase, acts as a ribonuclease. This component, PA component of the ribo RNA polymerase, cleave this host messenger RNA head, and after that you will see PB2 subunit of the RNA. Here is the PB2 subunit of the RNA. Attach this head with the viral messenger RNA, and after that you will see the replication happens later on, and this initiation will happens with the help of the third unit of the RNA polymerase, that is PB1. So RNA polymerase has 3 units and their action will be different, but the ribonuclease, that is the component of the RNA polymerase, will be inhibited by the Baloxavir. And next is the M2 protein. So in that case you will see endosome having virus in it, endosome having virus in it, and second is the lysosome. Endosome binds with the lysosome, and ultimately you will see the acidic condition, because lysosome having acidic conditions means more H positive ions in that case. Now these H positive ions will start moving into the virus through the M2 protein channels, and ultimately you will see the uncoating of the virus. All the RNA will start releasing into the cytoplasm, and ultimately they will go into the nucleus. So this channel is very much important in the uncoating. That is the most important process of the replication. So last group, amantadine and rimantadine, acts on the M2 protein and block this channel, and ultimately you will see the stoppage of the uncoating of the virus, and ultimately you will see the stoppage of the replication. So this is how amantadine and rimantadine acts on the M2 protein. So these are the 3 important mechanisms related to the influenza virus drugs. Next we will see the adverse effects. So first one is the GIT disturbance, and second is the nausea and the vomiting. These are related to the drugs taken through the oral route. And next is the respiratory tract irritations, that is related to the relenza, because relenza is taken through the nasal route. So irritation can happen through the relenza. And you can also see the bronchospasm in the patients like asthmatic patient and the COPD patients, chronic obstructive pulmonary disease patients. Next, most important, vaccine is a preferable method for the preventions of the influenza as compared to the drug. So preferable method will be the vaccine. Next, most important question, when to use antiviral drugs? So we have to use the antiviral drugs like drugs used for the influenza before exposure of the influenza virus. That is the most important, because it prevents the spreading of the influenza virus. And second, after the onset. So after the onset you have to take it within 24 to 48 hours to prevent the or spreading of the influenza virus to the other cells, and in that case you can see reduced in the severity and the durations of the influenza. So this is all about the influenza virus drugs. If you still have any question, you may ask in the comment section. Thank you so much.